If I go outside the house, I have a mask with me, and if I'm indoors anywhere, that mask is on, except maybe my private office after I close the door. If I'm outdoors, I keep that mask with me and I'll put it on if there's any chance that I'm going to come into contact with somebody else who's walking around or taking the dog out for a walk or something like that. I just went through a drive-through on my way back from a press conference, and I had my mask, put it on as I ordered at the drive-through, right? So that's just the behaviors we have to adopt. And once you kind of start doing that and get used to it, it's normal like everything else. I mean, I can remember when I was a kid and nobody wore seatbelts, right? And you're like, oh, this is terrible. I can't possibly wear a seatbelt. Now, if you're not wearing a seatbelt, you feel like something's wrong, like you're naked or something, right? And it's the same thing now with the mask and the hand hygiene and social distancing. Once you practice it, it's pretty easy. Many countries, Germany is one I've cited recently, comparing to the United States. When they put their mask ordinance into effect across the entire country, had good adherence to that, 40% reduction in cases within 2 weeks. In Shelby County, with our masking ordinances, at least in some of the areas they looked, we're seeing over 90% compliance. If we can keep that up and extend it, into the entire Memphis metropolitan region, not just the city of Memphis, but into some of the surrounding counties in Mississippi and Arkansas, which is we're going to need to do to solve this, we'll be able to eliminate transmission. And that's when we're going to not get back to normal, but at least we'll be able to open up a lot of more stuff and be able to have things like high school football that we all want to get back to, and be able to go to a bar and drink and have kids in school and feeling safe. So mask up, I think, is the main message that I want to try to get out. That's what's going to pull us through this. This is something that the pandemic has really revealed, some of these inequities. It's stuff that we've known all along here because we work in the healthcare field and we understand. But to many people are surprised to see that, well, gosh, our African American citizens, our Latinx citizens are the ones who are being most profoundly impacted by this. And again, it's the same issues I talked about. They're less likely to have primary care because Medicaid is not expanded and they're not being included in that. More likely to have chronic disease. We know that this pandemic virus will really hit hard those who have chronic disease, and then again, that's going to put them out of work and and kind of have this vicious spiral where you can't work, you don't make money, you can't get educated, you can't get health care because there's no Medicaid expansion, and people end up in poverty and broke, and the government has to pay for it in the long run. And again, it's much more expensive. But I just think it's been eye-opening to a number of people that thought, well, you can always go to the hospital, the emergencies room will take whoever, you don't have to have insurance. Well, we're seeing it with COVID, the inequities, but between the races that are caused by lack of universal health care are costing us all now, because they're filling up our hospitals, they're keeping us from doing elective surgeries, they're costing us money, and it's a huge cost to life. Now, the secondary effects we see are, that affect us really are in children. And we know that if mom is not enrolled in insurance, she's much less likely to get the kids enrolled. And now all kids in Tennessee, almost all kids, qualify for some sort of insurance, but you have to get out there and get enrolled in it, right? So if mom doesn't have insurance, she's unlikely to enroll the child. And of course, if they come to Bonheur, we can enroll them, but there's a significant gap in time where they're not protected, they're not getting their care, and when they come to Bonheur, it takes some time for us to enroll them, and it impacts our bottom line, frankly, where we're losing more money caring for uninsured kids who should have been insured had the whole family been insured in the first place. To say, hey, what is really the thing to do that our best experts say, and doing that as opposed to doing what seems politically expedient. So I have to give high marks to local government, low marks to the federal government, and I think the state's doing what they can and supporting the local government. I would prefer to see a strong centralized response to this across the nation, frankly, but we've gone it on our own, and I think we're doing pretty good. Mask up, Memphis.